Okay, so I've just washed my hands and I'm getting ready to assess my patient, Tiffany. Hello, my name is Samantha. I am your student nurse practitioner. Okay, so I'm just going to do an assessment of your abdomen. So I'm going to have you lay down for me. Very good. Okay. So the first thing I'm going to do is inspect her abdomen, and it is flat and symmetric. There's no masses or visible vessels. I don't see any scars. She has a couple tattoos and no rashes or anything. The next thing I'm going to do is I'm just going to auscultate. So I'm going to listen to your stomach. Okay. I'm going to listen in the, it might be a little cold, sorry. Right upper quadrant. Left upper quadrant. Left lower quadrant. Right lower quadrant. And her bowel sounds are normal active. I'm also going to listen to your aortic artery. And listen over your iliac or your renal arteries. Renal artery. Iliac artery. Iliac artery on the other side. And femoral arteries. Okay, and I don't hear any druids in any of her arteries, which is very good. The next thing I'm going to do is I'm going to percuss. Okay, so it's just going to be kind of like a drum. I'm going to do the same thing in all the areas. I'm sorry, my hands are very cold. Okay. Okay, and all of the 4 quadrants are tympanic, which is good because tympany means that there's air in there and they're not anything dull, so they're not detecting any masses. Then I'm going to check for your liver, and I want to make sure that it's not enlarged. I'm going to start here, and I'm going to percuss. Okay, so I start hearing it becoming very dull over here, so that means that this is the lower border, and then from the upper border, I'm going to start over here. Okay. And then it's starting to get dull right here. So that's the upper border of the liver. The next thing I'm going to do is assess the spleen. So I'm going to come over on the left side, and yeah, it's good right there. Perfect. And I'm going to percuss again. And when I get just below her ribs, I don't hear any dullness, which is indicating that it's good because your spleen is not enlarged. If it were enlarged, I would hear dullness below the level of the ribs. And then I'm just going to percuss your bladder here, okay? So over the bladder, I do hear dullness because it's an organ, so we're going to, that's normal, okay? Next, I'm going to just palpate, so I'm going to touch your stomach lightly, okay, and tell me if there's any tenderness, okay? Any tenderness? So no tenderness in all 4 quadrants, and I don't feel any masses. I'm also going to feel your arteries here, just to see if there's any, their pulses are good. So right pulse is 2+. And the left pulse is also 2+, which is very good, that's normal. And then I am going to feel for any, your inguinal lymph nodes. So I'm just going to feel down here, that's good. That's good. So I do not feel any lymph nodes, which is good, that means that there's no infection. The next thing I'm going to do is I'm going to feel a little bit more deeply in your stomach. I'm I'm going to assess your liver. So I'm going to feel your liver on the side. Again, I apologize for my cold. Okay. I'm going to lift them here, sorry. I'm just going to push up and breathe in for me. Breathe out. Again. Breathe out. Good. So I can feel the lower border of her liver, and it's nice and smooth, but it's not enlarged. I'm also going to feel for your spleen. So I'm going to do the same thing on this side. Perfect. Just like that. And take a deep breath. Again. Okay. And I do not feel her spleen at all, which is normal. We're not supposed to feel your spleen. And finally, over there, I'm going to feel for your kidneys. So, deep breath. Good. And then on the right side, deep breath. Good. So, what I was trying to do is I was trying to catch her kidney in between my grip, and I don't feel anything, which is normal. We're not necessarily going to feel anything, so that's very good. Okay, so the next thing I'm going to do is I'm going to look at your lower extremities. So when I come over here to assess your lower extremities, I don't see any redness. There's no edema. Do you have any pain here when I squeeze? No. So no tenderness either. Very good. And her knees feel good. They're symmetrical. There's no swelling noted or redness. No tenderness around the ankles either. Okay, very good. So I'm going to assess for your range of motion, okay? So first I'm going to assess your hips. So the first thing you're going to do is flexion. So what you're going to do is you're going to lift your leg, and you're going to hug it to your chest. Very good. That's perfect, just like that. Actually, I'm going to put my arm underneath you, okay, and do it again. Good. So her lower back is actually flattening into my hand, which is good. That means that everything is good. And do it with this hand, this leg. Perfect. So flexion is good. Then what you're going to do for extension, you're going to just lift your leg straight up. Just straight up. Yeah, one at a time. But yeah, that's good. Good. And the other one? Very good. Then we're going to test for abduction. So what you're going to do is you're going to take your leg and kick it out towards me. Very good. So abduction is good. Adduction, we're going to go in towards. Very good. Now I'm going to extend, I'm going to flex your knee here. And then I'm going to do medial rotation, which is good, and then lateral rotation is also very good. Okay, and we'll do the same thing on the other side. So you're going to, let's see, we're going to abduct first. So put your leg up, out to the side. That's abduction. Come back this way. Adduction, very good. I'm going to take it, and we're going to rotate it medially, and then rotate it laterally. Very good. Do you have any pain on any of those? Okay, perfect. Then we're going to do your knees. So same thing with your knee. We're just going to do flexion. So you're going to flex your knee down, and then you're going to extend it up. Very good. I'm going to do medial rotation, lateral rotation. Very good. And your other knee. So we're going to flex it down, extend it up, medial rotation, and lateral rotation. Very good. Okay. Now I'm going to test your ankles. Yes. Okay. So first thing I'm going to have you do is you're going to push down on my hands. Very good. So that is plantar flexion, and her strength is good in both extremities, bilaterally. You're also going to pick your legs up like you're, yeah, perfect. So that is dorsiflexion, which is good. I'm going to also assess, I'm going to take your foot, and I'm going to rotate it in. So that's inversion, and then I'm going to rotate it out. That's eversion. Any pain with that? Good. Same thing with the other side. I'm going to rotate it in. That's inversion, and rotate it out. Eversion. Very good. And I'm going to check your toes. So I'm just going to make sure they're each toe. Very good. Able to move full range of motion. Any pain with any of these? Very good. Okay. All right, now you can sit up for me. Okay. So I'm going to inspect your acromioclavicular joint. That's the shoulder joint right here. So I'm just going to feel for it, and you put your arm over just like that. There's no swelling or, is there any tenderness here? No tenderness, no redness. Same thing on this side, okay? So now I'm going to assess your range of motion in these arms, or your shoulders. So it might actually be easier to stand for this one. Okay, so we're going to do, so flexion is going to be up like this, straight up, put your arms, watch how I'm doing it, straight up like this, and then up. Perfect. That's flexion, and flexion is good. And then you're going to come back down and go back, which is extension, that's good. Then you're going to do abduction, so you're going to come out like this, and over your head, so out and up, good. And then extension of your shoulder, you're going to come like this across your arm. Good. And with the other side. Perfect. And then we're going to do medial rotation or internal rotation. So you're going to put your arm behind your back like that. That's good. And the other side. That's internal rotation. And then external rotation, you're going to come up like this. You're going to bring it up. Perfect. And the other side. Perfect. Very good. See? Thank you. Elbows. So I'm going to assess here the lateral epicondyle, which is good. There's no swelling here, no, doesn't feel like any abnormal bone structure here. Same thing with the medial epicondyle, which is good. Check the right side. So lateral epicondyle, very good. And the medial one, which is on the inner side, is also very good. So we're going to test for flexion. So I'm going to hold your arms and you're going to flex up like this. Perfect. And your strength is also good, 5+, which is the best you can get. And then extend down, so you're going to push down. Very good. Then we're going to assess, so you're going to have your hands out like this. So, and that is assessing for supination, and then pronation is this way. Very good. I'm going to assess your wrist now. So with your wrist, we're going to have them like this. You're going to flex, good, and then you're going to extend down. Very good. With your hands, you're going to flex your hands down, extend up. You're going to abduct your fingers, adduct your fingers, which is coming together. Then you're going to take your thumb and you're going to touch as far as you can go over on your pinky. Good, and with both hands. So that's testing for opposition, and it's very good. And I'm going to take a look at your hands here. So I'm checking her joints. So her distal pharyngeal joint is very good. There's no bony abnormalities here. Same thing with her peripheral pharyngeal joint. And everything looks good. And they're all moving with full range of motion with flexion and extension in each joint. Very good. Check this one. Okay, very good. And let's see. So for your back, I just want you to stand up for me, okay? And I'm going to look at your back. So the curvature of your spine, your cervical area, which is in your neck, there is no curvature, which is good because we want it to be a nice straight midline down your back. If it would be curved here, you would see kyphosis, but she does not have that here. And then for your back, I'm just going to take a look underneath, which looks good. So her spine is perfectly midline. There's no curvature, which would indicate scoliosis. And also for her, the lower part, the lumbar part, there is no curvature down there either, which would indicate lordosis. So very good. I'm just going to feel the muscles here. So her trapezius muscles here, and then clavicular muscles here. And there's no atrophy assessed. Any tenderness in there? Very good. Okay, you can have a seat for me. I'm sorry, one more thing I had to do when I assessed her hands, I just wanted to test your grip. So just grip my fingers. Perfect. So your strength is good. 5+, which is good. Okay, so now I'm going to do a neural assessment on you, okay? So I'm just going to basically test your brain function, okay? And I'm going to assess your cranial nerves. Your cranial nerves are all the nerves that are basically attached to your senses. So first thing I'm going to do is I'm going to ask you a few questions. Can you tell me your name?
Tiffany.
Okay. Do you know where you are right now? Where are you? You're at my house, yes. And what year is it?
15.
2015. Okay, so Tiffany is alert and oriented times 4 to person, place, and time. Can you tell me what you did last year on your birthday?
Went out with friends.
Oh, good. And where'd you go?
Down to Phoenix.
Oh, good. Okay, so Tiffany's memory, her remote memory is intact. I'm going to give you 3 words, okay, and I want you to remember them. Okay? Ball, table, cat. Okay, so you remember those. So there's also, okay, so there's something that people say all the time, and they say, 2 wrongs don't make a right. What does that mean to you?
What does it mean?
Mm-hmm.
Two people disagree.
Right, good. So her judgment is intact because she's thinking more abstractly rather than concretely. So very good. What were those 3 words that I asked you to remember? Good. So her recent memory is also intact. Okay, very good. Now I'm going to assess your cranial nerves. The first one is olfactory, and that one is going to be testing her sense of smell. So I don't really have anything with me right now, but if I had something in my hand, like let's say I had vanilla, you would smell it. First I would test patency of your nose, and if your patency is good, I would assess her sense of smell, and if she could smell the vanilla, then that would mean that her cranial nerve 1 was intact. Cranial nerve 2 is optic. So that is testing if you are able to see. So I'm going to ask you to read a few things off of here and just read a couple words. Yeah.
Inspection of curvature.
Good, very good. So that's telling me that you're able to see. And what I'm going to do is I'm going to test confrontation. So what I'm going to have you do is you're going to look straight, and I'm going to test your peripheral vision. Okay? So I'm going to come in with my fingers, and when you see my fingers, you're going to tell me stop. Okay? So you're going to look straight and tell me when, okay? Good. Good. So she's able to see from her peripheries, meaning cranial nerve 2 is intact. So cranial nerve 3, 4, and 6 are testing ocular motor nerves. You're going to follow my finger, okay? So this is 3, 3, 3, 3, 3, 3, 6, and 4. And Tiffany was able to follow my finger with her eyes, which means that cranial nerves 3, 4, and 6 are all intact. So cranial nerve 5, this is trigeminal. I believe cranial nerve 5 is trigeminal. So I'm going to check your motor skills by what you're going to do is you're going to open and close your mouth for me. Open and close. Good. Again. And then you're going to rotate your jaw back and forth. Very good. And then you're going to close your eyes. And when you feel my touch, you're going to tell me when. Good. So cranial nerve 5 is intact. For cranial nerve 7, this is your facial. Oh, by the way, for cranial nerve 5, that was motor and sensory, that is intact. For cranial nerve 7, I'm going to test for more motor in your face. So you're going to lift your eyebrows like this. Good. You're going to close your eyes tight so I can't pull them apart. Very good. You're going to smile, frown, puff your cheek out. Perfect. So cranial nerve 7 is intact. Cranial nerve 8 is acoustic. So it's basically your hearing. So I'm going to tell you, I'm going to whisper a few things in your left ear, and you're going to tell me what it is, okay? Good. And then on this side. Good. So Tiffany is able to hear on both sides. If you weren't able to hear, what I would do is I would test for lateralization. So that's basically going to tell me what type of hearing loss it is. If it's conductive or sensory neural. So what I would do is I would have a tuning fork. I would hit my hand with it, put it on top of your head. You would tell me if you can hear it in the right side or the left side of your ear or in both sides. If you can hear it in both sides, that's normal. If you can hear it in one side versus the other, we would determine if it's your good ear or your bad ear. If you're able to hear it in your good ear, that means that it is sensory neural hearing loss. And if you can hear it in your bad ear, that means it's conductive hearing loss. The other thing I would do, and that's called the Weber test. The other test I would test for is the Rhine test. I would do the same thing with the tuning fork. I would hit it on my hand, put it on the mastoid bone, which is behind your earlobe here. You would tell me when you can hear it and when it stops. When it stops, I'm going to put it in front of your ear canal. You're going to tell me when it stops. If you hear it longer through the ear canal, which is through air, then that's normal, because you're supposed to be able to hear it 2 times as long as through bone, because air conduction is longer than bone conduction for your sounds. So very good. Cranial nerve 9 and 10 are testing glossopharyngeal and vagus nerves. So for your glossopharyngeal, which is cranial nerve 9, it would be assessing your gag reflex. So I would actually use a tongue depressor and touch her tongue with it. I'm not going to do that now, but if you were able to gag, then that would be intact. The other one I will test is, I'm going to test phonation. So you're going to stick out your tongue and say ah. Open. All the way. Say ah. Good. So her uvula rose midline with phonation, which means that her cranial nerve 10 is intact. And cranial nerve 11 is spinal accessory, so I'm going to test your strength. So I'm going to have my hand here on your face, and you're going to just turn towards me. Good. The other side. Good. And you're going to shrug your shoulders. Very good. So cranial nerve 11 is intact, because she has good strength when she does that. And finally, cranial nerve 12 is hypoglossal, and that's, I'm going to check your tongue, so you're going to stick your tongue out. Very good. And you're going to say light, tight, dynamite. Light, tight, dynamite. Good. So cranial nerve 12 is intact. The next thing I'm going to do is I'm going to test your cerebellar function. Cerebellar is the part of your brain that's going to help you with movement and coordination of your movement. Okay. So the first thing you're going to do is you're going to do something called rapid alternating hand gestures. So what you're going to do, you're going to just back and forth, back and forth. Perfect. So you can do that. So that means that I don't see any issues with your cerebellum. Next one you're going to do is you're going to take your finger and you're going to touch my finger and then touch your nose. And touch your nose. Good. And with the other hand? Good. Very good. So that's intact. So, and of course that's another test that they use to test for intoxication. So it could be an issue with your cerebellum or for intoxication, which you're good, you're able to do that, so that is intact. The next one I'm going to test for is proprioception. So what this is I'm going to test if you're able to determine your position in space. So you're going to keep your eyes closed, okay, and give me your hand. No, keep your eyes closed. Good. And you're going to tell me if your finger is up or down. Good. And your other hand? Good. I'm going to do your toe the same way. Okay, close your eyes. Good. So proprioception is intact. The next thing I'm going to do is I'm going to test for sensation of your skin. So you're going to determine if this is sharp or dull. Okay, so what you're going to do is I'm actually going to, because I don't really have anything to use, I'm going to use the tip of my finger now or the pad of my, so I'm going to let you feel it now so you can determine the difference. You feel that? Sharp? Dull. Okay, so you're going to close your eyes and you're going to tell me what it is, okay? Your legs also. Very good. So she is able to determine the difference between sharp and dull. And then one more thing I would test for is vibration, although I do not have something that vibrates right now, but I would test her skin with vibration to be able to see if you're able to determine sense of vibration as well. Okay. And now I'm going to test deep tendon reflexes I do not have a hammer, but I will use a candle. Okay, so the first one I'm going to check is your bicep. So you just relax. Okay, so just relax your arm and very, very loose. Okay, and then so this is bicep. Good. Tricep. Good. The other side. Bicep. Tricep. Good. Then I'm going to do brachioradialis. So just relax. Good. Good. Okay. I'm going to check your patellar, which is your knees. So just relax your legs. Very good. Very good. Then your Achilles, so that's behind your ankle here. Good. Very good. So all of her deep tendon reflexes are all intact. Very good. And I'm going to test for a Babinski reflex. So what I'm going to do is I'm going to stroke the bottom of her foot upward. So I'm going to take this, take my hammer, stroke the bottom of your foot. Perfect. So, with her, nothing happened, which is a good thing. Another normal reaction to that would be your fingers pointing, or your toes pointing down. Now, an abnormal reaction would be in the Babinski. It would be a Babinski reflex. It would be seen in babies where their toes would actually kind of spread out, and that's normal in babies. If you see it in an adult, that would be very abnormal. So, very good because you don't have that reflex. And finally, what I'm going to do is I'm going to assess your gait, so your walk. So you're going to stand up for me. I'm going to first check your the mobility and range of motion of your spine. So you're going to do lateral bending. So each side you're going to bend for me. Very good. Very good. You're going to do rotation this way and the other way. Very good. So your spine has perfect range of motion. I'm going to have you stand over there and you're going to walk towards me. Just in a straight line. Perfect. And the gait is normal. Not unsteady at all. Very good. You're going to walk back on your toes. Very good. And come back on your heels. Perfect. So her gait is steady. That's very good. And you don't lose any balance when you're walking on your toes or your heels, which is very good. And then finally, I'm going to assess I'm going to use the Romberg test to test your balance. So you're going to do, you're just going to stand there and you're going to close your eyes. And she is not falling over, meaning she's not losing balance when she closes her eyes. So it's a good Romberg test, and then that's it. And that's it. So that's all I have for you. So thank you. It's good working with you. That's it.